Welcome to page 92 of Anatomy Coloring Book. This is Dr. Stephen Harkins. Today we'll be learning more about the autonomic nervous system, in particular more about the sympathetic division of the autonomic nervous system. So we talked about preganglionic and postganglionic fibers, or preganglionic neurons and postganglionic neurons. And of course, these are the sympathetic ganglia. Each one of these little bumps here represents a ganglia. We discussed how the ganglia exist above T1, even though the cell bodies of the preganglionic neurons are only from T1 to L2, thoracic 1 to lumbar 2, in the lateral horns there. But the sympathetic ganglia here allow the sympathetic nerves to go above and below the level of the spinal cord, or above and below T1 and L2. So the sympathetic nervous system doesn't just supply organs and glands from T1 to L2. They can also extend lower and higher because of these sympathetic ganglia. The sympathetic ganglia, of course, are all connected in the sympathetic chain. So, first of all, let's discuss and review the preganglionic neurons. So, of the sympathetic nervous system. Of course, pre, as we discussed, means before. Ganglionic, before the ganglia. So, right here, coming out of the lateral horn of T1 is a preganglionic neuron. Out of number 2, this is a preganglionic neuron, number 3. T3, T4. These are your preganglionic neurons. And of course, on the other side, these are your preganglionic neurons, because they are the neurons coming from the spinal cord before they reach the ganglia on the right and the left sides. There is a sympathetic trunk or a sympathetic ganglia chain on the right and the left side in front of each thoracic vertebra from T1, actually down to L2 to lumbar number 2. The postganglionic neurons, of course, are the neurons after that leave the ganglion heading outward toward the body parts. So they arise from the ganglia to the body parts. And here, for example, is an example of a postganglionic neuron arising from the superior cervical ganglia. That would be this one here. And innervating the lacrimal gland, or the tearing gland, the gland that causes you to cry, or that causes tears and keeps the eye nice and moist. And here, another postganglionic neuron to the mucous membranes of the nose and the glands. And here, another postganglionic neuron to the submandibular gland, to the parotid gland, etc. And that is sympathetic control of the glands. And of course, the signals would come from the lateral horn and rise up the sympathetic chain and synapse with the postganglionic neurons right here. The middle cervical ganglion, of course, would include the synapse would occur right here in this middle cervical ganglion, and the postganglionic signal would move out to the lungs and innervate the lungs. So if you saw a lion come around the corner, you were to be attacked, that's the path that the neuron, the impulse would take, the electrical impulse would take along these preganglionic, right here, then postganglionic neurons to tell your lungs to start breathing faster, to increase their rate so that you could be prepared to fight the aggressor or run away from it. And here we see the postganglionic neurons and innervation to the heart muscle. Of course, what do you think would happen if a lion jumps out at you? These postganglionic neurons would innervate the heart and tell it to do what? Increase its rate. Up. You need to pump blood to your muscles to get you ready to fight and or run away. And of course, these postganglionic neurons, where do they get their signal from? Well, the preganglionic neurons from the upper thoracic area, T1 through T4. And you can see these synapses occurring in the sympathetic chain, the right sympathetic chain, ganglionic chain. As we get lower, something different happens. Below at the level of, say, T5 here. What happens is the preganglionic neurons, they go right through the sympathetic ganglia and pass down to another ganglia called the celiac ganglia, or the celiac plexus, where they synapse with postganglionic neurons. So this whole collection of nerves, of preganglionic fibers, nerve fibers, neurons, has a different name. This is called the Splanchnic nerve, right here. The Splanchnic nerve, and it is filled with preganglionic neurons. Contrast that to above in the thoracic area, to the chest, to the lungs, and to the lungs and to the heart, where the preganglionic neurons synapse with the postganglionic neurons in the sympathetic chain here. In the ganglia, superior, middle, and inferior cervical ganglia, sooner, part of the sympathetic chain. And repeating, in below that area, in the abdominal area, they move right through the neurons to a plexus and a ganglia that's farther away. And so you get a postsynaptic neuron from the celiac ganglia heading to the liver to innervate the liver. Postganglionic to innervate the stomach. The postganglionic neuron innervating the pancreas. Your organs of digestion here. And of course, your preganglionic neurons coming from T10 there, going to synapse with the postganglionic in the celiac plexus. So this area from T5, T6, T7, T8, T9, this area supplying nerve supply to the liver, stomach, and pancreas, telling it to stop digesting and closing off the sphincters the sphincters of the stomach, stopping digestion. Because the last thing you want to do when a lion jumps out at you is to be digesting food. All your energy and resources needs to be saved for fighting or running away. Now here, coming from the lower thoracic spine, we have neurons that synapse in another ganglia, a different separate ganglia called the mesenteric. Let's do a new color here. The superior mesenteric ganglia. Yeah, we'll leave it at that. And then the mesenteric ganglia has cell bodies that go to neurons that innervate the colon, the small intestine, and the large intestine. There it is, superior mesenteric plexus or ganglia. And down here, this is the inferior mesenteric plexus or ganglia. And you can see branching off here is from the T12 area is a preganglionic neuron that is going to directly innervate the adrenal medulla. This is for, guess what? What does adrenal sound like to you? What does it look like to you? adrenal, adrenaline. So what it will happen is adrenaline will be pumped out from the adrenal medulla. Why? Well, that lion that came out to get you is going to kill you. You need adrenaline in your body, this hormone that gets you pumped up and ready to go, ready to run, and ready to fight. You've felt the effects of adrenaline before, certainly when you've been in a situation, a tense situation like that, whether it be an accident or a fight of some sort, your adrenaline gets really working. Out of the superior mesenteric plexus or ganglia also comes another nerve here to innervate the kidney or the renal gland, the kidney. Of course, what's going to happen to the function of the colon here? The colon is going to slow down its activity, and the small intestines and the colon are going to slow their activity. The kidney will slow its activity. It's not time to digest when you're running away or when you're fighting. Those resources need to be elsewhere. And the last two neurons, escaping, go straight through the sympathetic chain and to this other ganglia, the inferior mesenteric ganglia, from L1 and L2. And they synapse with postganglionic fibers that head to the colon, the lower part of the colon. Also to the urinary tract, your bladder. And what it does is it shuts off those sphincters so that you don't. A sphincter is something that is a shut-off valve. So it shuts off those valves and it increases the tension in those sphincters so you don't lose urine. So you don't digest and you don't process urine either. Let's see. Let's trace these preganglionic neurons that branch off right here. And they synapse at this plexus too, the inferior mesentery. And also here to there's a separate plexus or ganglia called the pelvic plexus. And these postganglionic neurons will head to the organs, the sex organs that control erection and ejaculation. Now on the left side here, it's what the author and the artist is doing is just separating out these two. What's happening here is diagrammed on the left is actually happening on the right side too, and what's happening on the right is actually happening on the left as well. And he just separated these two for he or she for the sake of the diagram. Okay, so what else happens in the sympathetic nervous system other than the lungs and the heart and the glands here? Well, the skin needs to be innervated too. The skin needs a supply of nerve information and nerve conduction. In order, it needs to be told what to do as well. So you see the preganglionic fibers all up and down the chain. They're all synapsing in the chain. Whereas some, as you know, some preganglionic fibers pass straight through the chain to innervate the digestive organs and the pelvic organs. All skin postganglionic fibers synapse right here in the ganglia. Okay. Where do they go? They go off to the skin. For what reason though? Why does the skin need autonomic activity? Well, it needs to be told when to increase sweat or decrease sweat. When that lion comes out to attack you, you are going to be active, running or fighting, which means you need to sweat. You need to sweat. So you need to increase the amount of sweat coming out of your glands because your body needs to stay cool. You also need your blood vessels to open up from small to wide. Why? Because you need more blood in your skin to let the heat out. Because you need your body to be cool. So the blood vessels will dilate and become larger. When you are under attack, what happens? The hairs on your skin stand up. So it causes the erector pili muscle to contract and lift your hairs on end. So that's the function of the sympathetic nervous system in the skin. And so we've talked about preganglionic neurons and the splanchnic nerve. The postganglionic neurons we've discussed to the head and neck, to the thoracic viscera, that's the heart and lungs, to the skin, the sweat glands, the erector pili muscle, the blood vessels to dilate, the abdominal viscera to shut down. We don't need to be digesting. And to the pelvic perineal viscera to also shut down. We don't need our pelvic organs or our abdominal organs to be functioning. That can happen later after the attack goes away. And your body begins to then relax, and your sympathetic system begins to calm down, and your parasympathetic system can then take over. That will be the topic of our next lesson. This is Dr. Stephen Harkins with page 92 of Anatomy Coloring Book. Until the next lesson.